Welcome to UMCC Medical Consulate and Connectors, where your health matters to us. Our lungs, those vital organs responsible for every breath we take, are enveloped by a thin, delicate membrane called the pleura. This membrane has two layers, with a small space in between them. In a healthy individual, this space contains a minimal amount of fluid, acting as a lubricant that allows the lungs to expand and contract smoothly during breathing. Pleural effusion occurs when there's an excessive buildup of fluid within this pleural space. This accumulation can be caused by a variety of factors, ranging from infections and inflammation to serious conditions like heart failure and cancer. The excess fluid can compress the lung, making breathing difficult and uncomfortable. Understanding the causes, symptoms, and treatment options for pleural effusion is crucial for early detection and effective management of this condition. Pleural effusion can stem from a wide array of underlying medical conditions. These conditions can be broadly classified into two categories: transudative and exudative pleural effusions. Transudative effusions occur when there's an imbalance in the pressure within blood vessels or a decrease in the protein content of the blood. This imbalance can be caused by congestive heart failure, cirrhosis of the liver, or kidney disease. Exudative effusions result from inflammation or damage to the pleura itself, triggered by infections like pneumonia, tuberculosis, or lung abscesses. The type of pleural effusion, transudative or exudative, provides crucial clues about its underlying cause, guiding doctors towards appropriate diagnostic tests and treatment strategies. Pleural effusion doesn't always present noticeable symptoms, especially in its early stages. However, as fluid accumulates, it begins to compress the lung, leading to a range of symptoms that can vary in severity. One of the most common symptoms is shortness of breath, often described as a feeling of not being able to get enough air. Chest pain is another frequent complaint, characterized as a sharp, stabbing pain that worsens with deep breaths or coughing. Other symptoms may include a persistent cough, fever, chills, and night sweats, particularly if the effusion is caused by an infection. If you experience persistent shortness of breath, chest pain, or any of the other symptoms mentioned, seek immediate medical attention for a proper diagnosis. Diagnosing pleural effusion begins with a thorough medical history and physical examination. Your doctor will ask about your symptoms, medical history, and any medications you're currently taking. During the physical exam, they will listen to your lungs with a stethoscope for any abnormal sounds, like decreased breath sounds or a pleural rub. Imaging tests play a crucial role in confirming the presence and extent of pleural effusion. A chest X-ray is often the first imaging test performed, providing a clear picture of the lungs and pleural space. Ultrasound can help determine the amount and location of fluid and guide fluid drainage procedures. If the underlying cause of the effusion is unclear, a procedure called thoracentesis may be performed to extract a sample of the fluid for analysis. Not all causes of pleural effusion are preventable, especially those related to underlying medical conditions. However, there are steps you can take to reduce your risk of developing this condition. Quitting smoking is paramount, as smoking damages the lungs and increases the risk of lung infections and cancer. Regular exercise and a balanced diet can boost your overall health and strengthen your immune system, making you less susceptible to infections that can lead to effusion. Managing existing medical conditions is equally important. Follow your doctor's recommendations for medication, diet, and lifestyle modifications. Vaccination against pneumonia and influenza can significantly reduce your risk of developing these infections, which can cause pleural effusion. The treatment for pleural effusion depends on the underlying cause, the amount of fluid present, and the severity of your symptoms. If the effusion is small and not causing significant symptoms, your doctor may recommend watchful waiting, monitoring the effusion with regular chest X-rays or ultrasounds. For larger effusions or those causing breathing difficulties, draining the fluid is often necessary through thoracentesis. If the effusion recurs frequently, a procedure called pleurodesis may be performed to prevent further fluid buildup. Treating the underlying cause of pleural effusion is essential for long-term management. This may involve medications such as antibiotics for infections, diuretics for heart failure, or chemotherapy for cancer. Pleural effusion, while a concerning condition, is often manageable with prompt diagnosis and appropriate treatment. Understanding the causes, recognizing the symptoms, and seeking timely medical attention are crucial for the best possible outcome. By adopting a healthy lifestyle, managing existing medical conditions, and staying informed about preventive measures, you can take proactive steps towards safeguarding your lung health. Always consult with your healthcare provider for any health concerns or before making any decisions related to your health or treatment. UMCC, your ultimate medical consultant connector.